You're listening to National Health Executive's Finger on the Pulse podcast with me, your host, Matt Roberts, to guide you beyond the headlines with news, views, and insider truths from across the healthcare sector. Today's episode of NHE's Finger on the Pulse podcast is brought to you by SilverCloud, the trusted leader in digital mental health and wellbeing. Over 500,000 people globally have been helped through their 30-plus digital therapy programs. Welcome back to NHE's Finger on the Pulse podcast. Today's episode sees us talking all about mental health, COVID-19, and how it all fits in together. But to offer valuable insight into these discussions for the day, I'm delighted to be joined by Dr. Lloyd Humphreys, who's Head of Europe at SilverCloud Health. Thanks so much for joining me, Lloyd.
No problem at all, thank you.
And I suppose there's a nice sort of stepping in point for maybe those in our audience who don't know what SilverCloud do. Would you mind just giving a little bit of explanation of both the organisation and also your role within it?
Yes, so SilverCloud Health is a digital mental health platform that has over 30 plus programs of internet-based cognitive behavioral therapy. So this means that people can access evidence-based interventions wherever they are, whenever they choose. So it's delivered by lots of different types of organizations. We work with over 150 plus organizations here in the UK and 300 globally within the National Health Service and outside of it as well. So to give you an idea of scale, about 75% of improving access to psychological therapies services use SilverCloud within their kind of their pathways. To give you a little bit of background on myself, I'm Dr. Lloyd Humphreys. I'm the head of Europe, so I look after the organisation within UK and Europe. And by background, I'm actually a clinical psychologist by training.
I suppose that gives you quite a unique insight into the discussions we're going to go on to, both from the clinician side and the sort of organisational side with your work currently. And it's one of those things that obviously, as we mentioned in the intro, part of this is around COVID-19, and while it is a respiratory virus in itself, mental health has been a huge talking point as a result of it. It's come to the forefront. Recent figures we saw ourselves at NHE were as many as 1 in 5 patients then suffering mental ill health down the line. All of this just it makes a real emphasis on why we have to get mental health right, don't we? It's significant now that we have provisions in place across the board.
Yes, absolutely. And we're seeing sort of 2 types of impact of COVID-19. The first of those with people with existing mental health challenges, where COVID-19 has exacerbated the challenges that they experience and perhaps kind of worsened some of their symptoms and presentation due to kind of some of the restrictions, some of the impact of the uncertainty. We're also seeing those that may not have experienced mental health in the past due to kind of the situation of the COVID-19 starting to kind of show signs of stress, trauma, and other types of kind of mental health as a consequence of having to deal with the uncertainty. So with this, we are kind of seeing a very significant kind of surge in mental health, and it's likely to kind of continue that kind of surge, which is going to kind of last much longer than the life cycle of the virus, if you like. We won't see some of those the impact of that for some time to come. So I think it's really important that we start to look at kind of prevention, proactive responses to the mental health crisis that is on its way.
Yeah, definitely. And you sort of touched on in that explanation about uncertainty and that having quite a big impact. Is that something that really makes such an emphasis on the situation with COVID-19, that it's not just the virus itself that can have these negative impacts, it's the uncertainty of going forward, it's the restrictions that need to be in place. It seems to have a much wider reaching or much more encompassing presence on mental health.
Yes, absolutely. So I think when people are trying to manage the impact, the emotional impact of not seeing loved ones, the uncertainty of kind of workplace and employment, finances, etc., that uncertainty it plays a critical role. The ability to have a sense of control is really important in everybody's well-being, and being able to psychologically prepare yourself for events and circumstances and situations is really fundamental. And so therefore the uncertainty that we've experienced is playing a real role. We saw this with the initial wave, particularly we're seeing this in NHS workforce, in the sense that people managed to kind of get through the initial wave, and when we kind of hit sort of July, August August, etc., we were starting to kind of feel that we were going to kind of come out of that. And then the second wave hit, and we hadn't really fully recovered from that initial wave as the second wave came. We were told that obviously that there was hopes for a vaccine in September, and then, it's looking likely for December. So that uncertainty continues. And because of that, obviously, our ability to kind of manage the psychological impact is taking its toll.
Yeah, absolutely. And that especially is probably one of the reasons we are seeing quite a lot of people who are newly presenting mental ill health, or they're seeing problems exacerbate to a point where they feel they need treatment. And that really runs into one of the biggest points that's always been for mental health long before COVID, which is around stigma and making sure that solutions are accessible. Just how important is it, especially now with people who are maybe new to engaging with mental health services, that it is a free and open environment?
I think is absolutely fundamental, because the universal truth is that we all have mental health, and we're all on that continuum, and we move up and down that continuum from good mental health to kind of not so good and poor mental health. And this is really important, that we need to not talk about mental illness, but talk about mental health. And mental health is important to us all. So the way that we talk about it, the way that we communicate is absolutely kind of fundamental. And particularly during the pandemic, we must resist the urge to pathologize people's experiences. I'd like to be kind of really clear on this, is that, huge numbers of people are having a completely normal reaction to an abnormal situation. And that's very different to when we think about sort of diagnosable kind of mental illness, when people might be experiencing an abnormal reaction to a normal situation. So it's really clear that we shouldn't kind of pathologize, that we need to kind of normalize that these are normal reactions to a very unusual situation. And we must provide support around that. We mustn't take a kind of a disorder or a diagnostic necessarily approach to this.
Yeah, absolutely. I think that's such a brilliant way of putting it, that it is such unusual circumstances that, of course, people are going to react in a way that is not what we'd normally see in greener pastures and better times. And that really does help break down barriers, doesn't it? Because if people can talk about it, and that's in all sorts of means, that's everything from discussions like this through to just talking with close loved ones. And the current situation, that can be very difficult for some people if it has to be through a phone or online or something like that, can't it?
Yeah, absolutely. And people want to access support and help in their own way. And that means that kind of digital is not necessarily the panacea that should kind of replace other ways of kind of treatment, but it is part of a package of care that can be made available to kind of help support different ways. And obviously kind of the younger generation like to kind of access digital on demand when they kind of pick up their device. Other people want to kind of talk through that, whether on the phone or video consultations or even face to face. So we must be able to kind of have solutions that kind of address all of those ways without kind of having someone feel like they're accessing a mental health service, for example, but they're getting the right support in the way that feels comfortable for them. And I think being able to kind of demonstrate that is really clear. And the way that we kind of communicate it, yesterday I was really kind of pleased that NHS Wales has taken a national approach. Eleanor Morgan, the Welsh Minister for Mental Health, launched kind of SilverCloud for every Welsh citizen. But I was watching kind of the Ireland versus Wales football game. I won't mention the score, but during that, advertisements for SilverCloud and accessing support from NHS Wales were on the hoardings. And it's just our kind of conversation is really important to make it familiar, to make it available in every type of setting. So it doesn't feel that this is an illness kind of approach, that this is part of our day-to-day experience.
Yeah, absolutely. It's sort of normalizing it and seeing it in everyday situations, like you say, in the football, where people who engage with that may not be the same people who would engage with other traditional means for it. And it segues quite nicely into the fact that, as you touched on, SilverCloud are a digital mental health provider. And so it's obviously not a panacea for all, but what role does and can that technology play in providing mental health care in the modern day?
Well, there's different ways of digital being able and technology being able to support new ways of working. And I'll talk about kind of some of the impact of that a little bit later on, but it's important to kind of know. So technology can really help transform and help us deliver services that we wouldn't be able to deliver face to face. So, for example, video or online consultations, or text messaging, for example. And they're really fantastic because you don't have to be in the same place at the same time with the person. But they are still what we would call a one-to-one approach. You still need to organize that to be on the end of your device at the same time, and you can only deliver the support to one person at a time. So whilst you have those efficiencies and you can overcome some of the restrictions that we currently live in, they're kind of limited in terms of some of their efficiencies. Then we can kind of have a look at what we call the one-to-many approaches in terms of digital or technology, where many people can access a service at the same time and gain support and benefit from them. And that's kind of where SilverCloud sits really as a one-to-many approach. And therefore, you kind of don't have a ceiling in terms of the efficiencies because, as I mentioned, in terms of kind of Wales or places like Scotland or the NHS improving access to psychological therapy services, they can kind of deliver services to as many people as want to access them immediately at the same time. And then what you kind of need to look at is in terms of awareness, which we talked about, but also kind of capacity. So what we found during the initial wave of COVID-19 is that a number of NHS mental health services either had to kind of significantly reduce their capacity because staff were redeployed, or even in some kind of rare cases, they had to kind of close because they didn't have staff available. During that period, we saw that referrals into IAP dropped in some months, not every month, but in some months by about 57%. But what we found with SilverCloud is that the use and reliance on digital increased very significantly. So in those same months where referrals dropped by 57%, the use of SilverCloud increased by 183%. To the point where in some of those months during the initial wave, nearly 30% of all mental health care delivery in primary care in IAP was delivered via SilverCloud. Now, this kind of tells us the importance and the role that digital has to play. Now, kind of post-COVID, it might kind of drop down a little bit, obviously, as services come back online, as kind of referrals increase. But it just shows you the ability for digital to flex to surges in capacity needs, around a service.
Today's episode of NHG's Finger on the Pulse podcast is brought to you by SilverCloud, the trusted leader in digital mental health and wellbeing. Over 500,000 people globally have been helped through their 30-plus digital therapy programs. Absolutely, and it's also very telling, isn't it, that if you'd maybe just took the face value that some people might have, referrals are down this way. Actually, that's not the whole story. And it's maybe just people getting services in different ways, especially with restrictions going on. They maybe didn't feel comfortable attending in person, or they might have found a way that works better for them, their daily lives.
Absolutely. There's many different reasons for that. I think one of the primary reasons is kind of referral pathways. Often in terms of getting access to a service, you have to go via the GPs, for example. The GP is the front door to accessing services. So that might have become a little bit more difficult during the initial wave. People might be less kind of wanting to do that, finding support elsewhere. So SilverCloud spun up a number of different support services to help people access it in multiple channels. So people may have been accessing it in different ways. People might have kind of found some barriers or hurdles, or may not necessarily have been ready to access those. But that's kind of the power of digital, being able to kind of be there when that person needs it, without wait, without delay, and in a way that's convenient to them.
Yeah, and I suppose we touched on slightly there the key sort of points we need to achieve as a digital service being provided. But have there been any real challenges sort of faced from SilverCloud, especially with such a significant move into sort of people accessing more digital mental health provisions? Were there any significant challenges? Was there anything that sort of you had to adapt to working in a more digital sphere?
Well, there's a number of different challenges, but I think they kind of cover a few broad areas. The first is making kind of your programs and your content appropriate. So when kind of COVID hit, we were aware that we had to kind of take a different approach. And we talked about sort of the mental illness model versus the mental health model. And so the way that you might kind of approach anxiety disorder wasn't necessarily appropriate, because some of those kind of CBT techniques are about facing your fears and being able to challenge some of the negative thoughts that you might have. Well, that's not appropriate given a virus and the potential for kind of contagion. So facing your fear, these are real fears. So actually, that it wasn't really appropriate. Some of the coping strategies that we might develop, such as building on your social network, socializing and things like that, weren't necessarily kind of appropriate either. So what we did is we kind of had a look at, well, how can we make some programs and content that was appropriate to kind of dealing with life's challenges such as kind of COVID-19. So we actually developed a brand new program, Space from COVID-19. We developed that in less than 2 weeks and launched to market in 3 weeks. We pulled all of our development team. So that was one of the first challenges. How can we kind of be as agile and nimble in terms of program and content delivery and get this out into as many people's hands as possible? So that's kind of one of our internal challenges. One of the other challenges is that you might be able to kind of make your service available. So when we worked with NHS Workforce, for example, and the Health Service Executive and other kind of NHS organisations, as well as the Department of Health and Social Care, we kind of spun that service up to cover about 5 million people in less than a week. So the challenges around the technical side of those are fine if you have that scalability built into your platform. What's the biggest challenge is actually the awareness. It's no good just kind of making something available if people aren't aware that it's there. And so one of the biggest barriers, one of the biggest challenges is how do you kind of let people know? And so often, we rely on things like social media. But if we think about kind of, say, the nursing workforce, a lot of these are, a lot of people are working longer hours, than they ever have, not having the time to kind of engage with social media. So if you kind of rely on one kind of channel of awareness, then that's going to be that's not necessarily going to kind of benefit the awareness and the availability. So I think for me, that's one of the biggest challenges. How do you make people aware? So being able to have multi-channel campaigns, being able to make people see that this service is available. So for example, one organization we work with made this available for a very large grocers. And rather than social media, they were putting posters on the back of toilet doors with a QR code. So people were able to kind of see that, access it, and that availability and awareness was there available to them. So I think there's lots of different things that we can kind of play on. But those are some of the biggest challenges around awareness.
Absolutely. And as you say, it's sort of having that innovative thinking to realize that perhaps the way that has always been done isn't necessarily the way that works best in the current situation. It's a very unusual circumstances, as we've mentioned. So perhaps it needs an unusual way of raising awareness or thinking about these things.
Absolutely, and we can see that from NHS Wales with kind of the advertising during kind of the football. So it does, and often we kind of think around about kind of the obvious platforms like Facebook and Twitter, and kind of throw out some of our old ways of working, in favour of kind of some of the new technologies. I think we need to kind of embrace those innovative ways as well as kind of the traditional ones as well. We need to kind of access this elsewhere, and we've seen this, in places like in Essex. So in the past, Mid-Essex CCG, the Clinical Commissioning Group, have done kind of a multi-channel campaign. They've had people on World Mental Health Day walking around the towns in Mid-Essex with kind of sandwich boards, with kind of an iPhone on or a mobile phone on them, saying kind of access digital support this way. They've done targeted Facebook ads where they wanted to kind of tackle young males at risk of suicide and depression. So they've kind of done lots of different kind of campaigns around this with huge success. So yes, we do need to kind of think, really innovatively about that awareness. We do know people will use digital if they know it's available.
Yeah, it's absolutely that sort of thing. And sort of as we move on to the next stage of questions, so Hopefully, looking forward into the future beyond COVID, or at least into a world where we're more equipped to deal with it. What sort of lessons that we've learned over the last 12 months do you think we can take for the future delivery of not just digital mental health services, but mental health services across the board?
Well, I think some of the lessons are that digital should have parity with other traditional forms of therapy.
Yeah.
So we know that digital therapy is effective. SilverCloud has published over 35 plus kind of studies, including kind of the only long-term follow-up randomized controlled trial of digital therapy that was published in Nature journal earlier this year, that showed that SilverCloud was not only effective before, during, and after treatment, but at 12 months, people had continued to make significant gains to the point where 50% of people had shown significant reduction in the symptoms at 12 months after kind of that initial treatment episode. So we do know that it's effective. NICE has also can kind of confirm that in terms of their medtech evaluation. So we know that the kind of digital therapy is effective. So for me, the question no longer becomes, is digital therapy effective? The question should be asked, where can it now add more value for mental health services? And so what we've seen over the last kind of 8 to 10 months is that digital therapy is used right across the board. So not just with people with mild to moderate depression or anxiety, but not just for people to help manage their well-being and improve their resilience, but also people with serious mental illness. So there's one service in Northeast London, for example, that's using it in their psychotherapy service. That's people with, significant kind of long-term mental health challenges, including people with personality disorders. And we've shown that service has shown that 49% of people using kind of SilverCloud as part of a multi-component package of care has shown significant reductions on their core assessment measures, the core 10. So we know that it works right across the continuum of experience. We've also kind of implemented this for children and young people. Whilst we're talking about adults right now, we shouldn't forget that some of the greatest uncertainty is with the young people today. You know, we've seen that in Scotland that they're kind of postponing exams. We've seen in Wales they've kind of curtailed the exams, their GCSEs for this year, and England is still yet to kind of make a decision around that. So there's huge uncertainty around GCSEs, A levels, and beyond. So we need to kind of make sure that we are not just focusing on kind of, adults, but also on the next generation as well. And that's kind of why we've kind of released a children, young people's program to help manage kind of anxiety. We have student versions for universities, and 35 plus universities use SilverCloud. So I think it's really important that, digital is used not just in one particular area, but can be used right across mental health services in different ways.
Definitely, and especially as you touched on there with sort of young people in the next generation, being that proactive and being able to sort of help support now in means and in services digitally that are more attuned to the ways they will access services and the sort of broad scope, that will have a knock-on effect down the line, because for many of those people who have support, hopefully they can engage with services now. They may not need to down the line, because they may find sort of coping methods and ways that improve their mental health. And as we say, it's very much a spectrum.
Yes, absolutely. And I think we need to look at that proactive prevention. The NHS is fantastic, in everything that it does. Our workforce, is commendable. But often the National Health Service kind of is very reactive, because it has to be. It has kind of limited resources and the ability to use those. So we often kind of work in very reactive ways. And for the first time, I'm seeing this kind of real move to really great kind of planning and prevention, because we can kind of foresee some of the things that are coming down the track. And I think we need to kind of continue to build on that wonderful work in terms of planning, prevention, because there's so much things that we can kind of do now that's going to help us not only in the short term, but also in the long term, particularly with young people. We do need to kind of make sure that help is available right now.
Yeah, absolutely. And we've talked quite in depth there about sort of the future of mental health care going forward. From a more sort of SilverCloud approach, are there any milestones or objectives yourselves hold going forward in, I don't know, the short and medium term? through to the long term?
So for us, there's a couple of things that are really important. As I mentioned, the children and young people is a real focus for us because, we need to, everybody needs to invest in the children and young people. This is kind of the future generations. So we need to kind of do that right now. And that means that not only do we need to kind of make our programs available for those that kind of pick up their mobile phone and use it, but also we know that kind of parents and carers, they're the ones that can kind of help their kind of children, so being able to deliver parenting programs and things like that. So that's kind of a real kind of focus for us. The other thing is that we know that digital therapy can be used in lots of different ways, from self-help to supported to being part of blended therapy. So for us, being able to make sure that the different ways that people use SilverCloud is maximizing their outcomes. So earlier this year, we published in the Journal of the American Medical Association a piece of work that looked at machine learning to be able to predict outcomes using digital therapy. And what that machine learning did is it showed that there was typically kind of 5 types of users. For those that kind of come in and use a lot of the content immediately and then kind of it tapers off, to those that kind of come in and steady and log in frequently and regularly, to those that might delay, etc. And from those 5 clusters, we can predict with a significant degree of certainty how well they're going to do. So that should allow us to be able to kind of tailor those that might access SilverCloud by themselves as self-help versus those that might want kind of support and need more of that. So for us, just being able to kind of match the service to the people accessing the service is really key.
Yeah, I mean, that in itself will have a huge impact because obviously, as we've touched on, the benefit of SilverCloud, it is one of these one-to-many services, but to be able to tailor that slightly gives you some degrees of the best of one-to-one as well.
Absolutely, it does. And so and again, being able to be able to tailor a service to the unique needs of the person is going to kind of improve. It becomes almost that self-fulfilling kind of virtuous cycle, doesn't it? That actually, if you know how someone wants and needs services and you can tailor it to them, then the outcomes are going to get even better. And therefore that's going to just kind of make the outcomes benefit everybody.
Yeah, absolutely. And I suppose what's a really nice, strong sort of point to go on is we've talked a lot about how sort of we can get patients to engage with it, how we can get general public to engage with it. As a maybe clinician or an organisation looking to use these sort of services, what would be sort of one piece of advice to them to deliver mental health care and particularly to engage with and be able to offer digital mental health care?
Well, often as clinicians, when we go through our training, we're kind of trained in lots of different kind of tools and techniques, and we kind of then embed these in our practice. One of the problems is that the digital therapy is not yet kind of mandated on training courses. So often we're kind of working with clinicians that are kind of relying on their traditional ways of working. So I would say my one piece of advice is that let's kind of have a look at the evidence and try this to see whether this is going to benefit your clients. The training is available, the support is available from SilverCloud and others. And as we kind of embed this in some of the training courses, like we have done at the University of Central Lancashire or at UCL in London, as we start to kind of do that, my one piece of advice is firstly, see whether this is going to be effective for your clients. And secondly, don't make assumptions of who might benefit. Often we kind of think, well, it's not going to benefit this person for these reasons. And often those assumptions are not always kind of correct. So I would say just don't make these assumptions over who will benefit or who won't. The client will let you know.
Yeah, amazing. I think that's such a wonderful way to sort of leave on as a benefit of sort of digital mental health. It's very much open to everyone. I think from both myself, it's been absolutely fascinating to talk to you. It's been really insightful. But similarly, I'm sure from all of our listeners, it's been a great sort of breakdown of all the different aspects of what is something we've probably all heard of, but have never really delved into so much. So thanks so much for taking the time to talk to it today, Lloyd.
Not a problem at all. Thanks very much for making the time.
Today's episode of NHG's Finger on the Pulse podcast is brought to you by SilverCloud, the trusted leader in digital mental health and wellbeing. Over 500,000 people globally have been helped through their 30 plus digital therapy programs. Thanks for listening to this episode of NHE's Finger on the Pulse podcast. Join the conversation on social media or get in touch through the link on our website. To stay up to date with all the latest news and episodes, make sure to subscribe, drop us a rating on whatever streaming service you're using. This has been National Health Executive's Finger on the Pulse podcast. Thanks for listening, and I'll see you next time.